Medicare Advantage and Part D change every year. They change in January. And if you're watching this in the fall leading up to that, you're getting a lot of mail. I'm going to explain that in this video. Stay tuned. You know, if you've been on Medicare Advantage or Part D for a while, you kind of understand the Part D, you pay so much a month for your plan. And then you have copays depending on how expensive your drug is. Cheap drugs have cheap copay. Expensive drugs have a more expensive copay. And then you have your coverage hole, and then you have to spend so much to get out of it. To get out of it this year, you know, that goes up every year. It's going to be about $7,050 total, what you spend to get out of it. So most people don't get there. Let's talk about something that does affect everybody on Part D, and that is the drug deductible. The drug deductible for 2021 was only $445. Part D didn't come about until 2005. So for 35 years of Medicare, there was no drug benefit. So those of us that have been doing it for a long time, we're like, yay, this is awesome. If you're just new to Medicare and you've been on it a couple years or you're coming on it, you're like, it's not awesome. It doesn't pay everything. And I don't like it. And we're used to that. But we love it because we know our clients used to have nothing. So kind of keep that in mind. Just a couple years ago, I'd say for maybe like the first 10 years of Medicare Part D, there was no drug deductible. Those were the sweet days. Then it was a $100 drug deductible. And now here we are. In 4 years, we were at $445. And now for 2022, it's going up to $480. So you see where this is going. Now, the thing to understand when you're trying to compare a drug plan on your own, you're trying to look at Aetna CVS versus WellCare, and you say, okay, this one has a deductible, $480, and this one's deductible is only $200. So you think, wow, this one's better. It's not that simple. Wish it was. Just because a plan has a deductible on their drugs doesn't mean that it applies to all their drugs. So it's typically, like I said, this varies plan to plan, state to state, county to county. It's on the most expensive drugs. So if you're only taking rather inexpensive drugs, tier 1 generics, tier 2 generics, a lot of times with most plans, there's no deductible. You don't have to deal with that. That won't come into play until you come into higher tier drugs. So don't just think that larger deductible is a differentiator. There's a lot more that goes into figuring out what's the best drug plan for you than the deductible. But that's one thing people understand. If you don't have a deep knowledge in insurance, we all get deductible. Not so sure on the copay and in-network and out-of-network and co-insurance, and most people don't get that stuff, but they know deductible. So they mistakenly assume that's a really good thing to make your choice on, and it's not. That's why I said it doesn't cost anything to work with us at the Medicare Family. So call us, let us bring our expertise to bear. We're already priced into the plan. If you just call, Cigna direct and you want to buy their plan, you don't save money. If you call us, you don't have to pay extra by using us. It's the same price. We're already priced in. You can't save money like Amazon. So call an agent that specializes in Medicare and let them bring their experience to the table and explain this in a little bit more detail so that you can make the right decision for 2022, because it's really a 1-year decision. If you have questions, my family would love to help your family. Call the number on the screen or hit me in the comments below. Thanks for watching.